Welcome back. Well, summer is here, and that has many of us breaking out our warm weather wardrobe. But if you have spider or varicose veins, you may not be as ready to pull out those shorts or skirts. The U.S. Department of Health and Human Services estimates that more than 50% of women and 40% of men face abnormal leg veins. Corewell Health Vein Center, formerly known as Spectrum Health, provides innovative treatment that could give you faster results with less discomfort. Joining us this morning is Lauren Gressley. She's a nurse practitioner. She's got some answers to help us all get ready for our summer wardrobe. Good morning, Lauren.
Good morning. Thank you so much for having me.
Well, thanks for being here. So first, explain the difference between spider and varicose veins. They're not necessarily the same thing.
Yeah, spider and varicose veins are different. And a lot of times what's the difference about them is going to be the size of these veins. The spider veins are going to be really tiny ones. They can vary in color from red, purple, even blue, but they're very, very tiny veins along the leg. And then the varicose veins are going to be larger in size, and they are going to be more like a rope-like on the veins. They can bulge outwardly, but they're definitely going to be larger than those little tiny spider veins.
And so why do we get these?
So all of these veins in our legs, and really any vein throughout the body, has these one-way valves, and these valves are supposed to open and then close on the leg and these veins. And if that little one-way valve is not functioning appropriately, it can cause the blood in that vein to backflow, causing the veins to get larger in size.
Okay, and so some of our lifestyle factors, though, may make this worse. So talk to us about that.
Yeah, there are several things that can contribute to why these spider veins or varicose veins develop on specifically the legs. Sun exposure can be one thing that contributes to this. Increasing age, so as we get older, the skin just becomes a little less elastic, and that can contribute to this as well. Multiple pregnancies in women can play a factor in this condition. Any extra weight we have on us, so obesity plays a factor. What you do for a living, sitting, standing for a job for long hours during the day can put pressure on those little one-way valves. So lack of movement is also a contributing factor.
Okay. And, you know, we've talked a lot about the cosmetic issue, but are these actually dangerous to our health?
Yeah, so ultimately the veins then in themselves are not super duper dangerous, but if left untreated down the road, it can lead to various complications. And those can include some skin changes down on the leg. And when that skin makeup starts to change, it makes the leg and the skin more susceptible to ulcerations or open wounds on the legs. When we have these big bulgy varicose veins as well on the leg, they can be more susceptible to developing a blood clot even. So those are some of the main complications, but again, those are when the veins get much larger in size. But if you have either of these, symptoms, or you're noticing these on your legs, it's always good to get them checked out to see if you would be at risk for any of those complications down the road.
Absolutely. And so this is obviously age is a huge factor in this, but are there things people can do to reduce their risk of developing spider or varicose veins?
Yeah, absolutely. So just as you mentioned, some of these risk factors are not something that we can change, such as age, but different things that you can do to help out are maintaining a healthy weight, exercising, so that calf muscle contraction every time that helps propel that blood up and out of that vein. So walking, running are great exercises that you can do. Avoid wearing high heels. That can put pressure on these little one-way valves. And of course, applying your sunscreen when you're outdoors.
Okay. And talk about treatments. What kinds of treatments are available, and how can someone learn more about that?
Yeah, so there are several different ways that we treat these veins. The conservative treatments for the veins are going to be compression stockings. And we ultimately would like patients in a compression strength of 20 to 30. So if you're looking at the box when you're buying compression garments, that's a good one to shoot for. And then there's ways that we treat the veins from a procedural aspect. So spider veins, we treat with what's called sclerotherapy, which are tiny injections into these veins that get the medicine that we inject gets that vein to react and close down. Ultimately, the vein itself it can take a few sessions to get those to close down. And the veins can look a little bit worse before they start to look better, but that's our cosmetic treatment for those wispy spider veins, so those really tiny ones. When they get larger in size, so those varicose veins, we can do multiple procedures again to close those veins down. And two of the different procedures that we do to close down the bigger veins, one is called VenaSeal, and that essentially that they deposit a small amount of adhesive into that vein that gets that vein to seal off. The other is a radio frequency ablation, and that uses heat to get that vein to react and close down, and that will redirect the blood flow into the deeper, healthier veins. The one nice thing about the VenaSeal procedure is you're not required to wear compression stockings after. So with these nice summer months, it's a great option to treat some of those larger veins.
All right,
the varicose veins on the legs, we treat in a couple different ways as well. We can do a phlebectomy that removes these larger veins, or sclerotherapy, which is similar to the spider vein treatments where they inject a medicine.
All right, Lauren, thank you so much for all of that information. Of course, you guys do free screenings as well. So if people are concerned, they can come see you. We have the number here on your screen right there. You can schedule an appointment with MyChart, mychart.spectrumhealth.org, or that phone number on your screen, 616-391-VASC. We'll be right back.